Good evening to all. The 50th medical term that we'll be focusing today is on leptospirosis. Yes, it is also a bacterial infection, and this bacteria is from the genus Leptospira, and of course, it is transmitted from animals to humans, therefore, it is classified as a zoonotic condition. All right. So, how does it really transmit to human? Well, if the animals are infected and if they when they release their urine or sort of body fluids of these infected animals, then it can enter into the human body, or through contaminated fresh water, soil, especially due to heavy rainfalls and flooding, or especially if there's a cut in the mucous membrane of our body, these bacteria can directly enter. So what are the risk factors? So certain occupations, especially farmers or even veterinarians or sewer workers, because they deal with all these, contaminated environmental exposures, or even during recreations like swimming, canoeing, all such activities, especially dealing with water. Environmental factors like even poor sanitation, or if there are rodents like rats and mouse, then even flood and hurricanes, and that is natural disasters, calamities can also induce this. So if you look at the signs and symptoms, there are basically three phases. The first phase, which is called the acute phase or the septicemic condition, that is where the bacteria are high in number inside the blood. This can happen somewhere around 2 to 30 days after the exposure, where the person starts suffering with symptoms like fever, chills, red eyes, and even abdominal pain. Second phase is where the immune system tries to protect, because the immune system identifies these as foreign antigens and they start attacking. But however, the attack may not only destroy the foreign antigens, but also it can cause healthy cells, sometimes like self antigens to be destroyed, and organ damage. Multiple organ failures can happen. And the third one is a more severe phase. That is, if the second phase is not recovered or there's no proper treatment, then the disease is called Wales disease, where jaundice, yellowish discoloration of the eye, kidney failure, hemorrhage, and even severe pulmonary hemorrhagic syndrome can also happen. So that is how the many organs are affected. So you can diagnose this by looking at the risk. Blood or urine test can be done, or even the microscopic agglutination test. To treat, we have to give antibiotics like doxycycline, penicillin, and even supportive care, dialysis, to prevent, of course, you have to reduce the exposures.